I'm talking in this video about hormones because, look, it's a huge part of my practice. Um, Also, we get a huge amount of questions about it, and increasingly, frighteningly, I see younger and younger people who have hormonal issues. Okay, so let's start from the beginning, basically. So, young girls who don't start their periods until later, usually their thyroid's low. Now, it can also, the adrenal glands that sit on top of the kidneys can be on top of that, can be involved in that because the thyroid and the adrenals are best friends. They're conjoined twins. If one is low, the other one's get slow. Which is first, the chicken or the egg? I mean, you have to see if you're all traumatized and, emotional trauma, etc., stressed out. Sometimes the adrenals look first and then the thyroid second. But usually young girls who don't start their period till later, their thyroid's low. And so you have to go by symptoms when you treat hormones, okay? I'm very much about looking at the symptoms on the website of low adrenals, low thyroid, low estrogen, high estrogen, low growth hormone. Everything is there, basically. So look at those symptoms and print them out and fill them out for yourself. But self-diagnosis is often not safe or correct with hormones, okay? Which is why we do virtual consultations, because people need a lot of help, which sadly they're not seeming to get, to my satisfaction at least. Okay, so that's young girls. Okay, so as you start your period, okay, if you have terrible cramping, heavy bleeding, that's always low progesterone. But you don't take progesterone because your body's making plenty of progesterone. It's usually your thyroid's low, okay? So again, you look at the foundational issues. You first make sure the adrenals and the thyroid are good, and that's the most important part, is thyroid and adrenals. And then that usually will fix the progesterone, okay? The body will fix itself. When you're young, you give the body the opportunity to fix itself. When you're menopausal, the body can't fix itself because you're not popping an egg anymore. And progesterone's made when you pop an egg, okay? Young girls who get middle schmerz, as it's called, where these horrible pains when they pop an egg, their thyroid is generally low. Why do you get breast cyst? When you have middle schmerz and you have that terrible pain when you pop an egg, it's because the lining of the egg is too thick, and that's from low thyroid, okay? But sometimes, when it's really bad, I will give them a little bit of progesterone, okay? That's why I made progesterone support, and it's on the website. It's 20 milligrams per pump, and I will often start with giving them some progesterone 1 pump, starting if they have terrible period pains, they can't go to school or wherever, whatever they're doing, can't go to work, they've got horrible cramping, they bleed like crazy, and the thyroid they've fixed and it's still terrible, then I will give them a little progesterone 1 pump, 20 milligrams, starting day usually 21 until the day the period starts, and then I stop. Okay, now this is why you have to often have a virtual consultation on this one, because sometimes I'll start day 14, sometimes I start day 21. But progesterone is very important in young women, but thyroid and adrenals is first and foremost. Okay, now I do not bring in DHEA, estriol until people are older. Okay, I have DHEA pills, 25 milligrams per pill, on the site for older men. And by older, I mean, look, I see young men nowadays in their 20s who don't have enough testosterone because their thyroid and adrenals are low. They're so stressed. Their thyroid and adrenals are low. So again, you got to fix the foundational issues first, and then the body will usually fix itself, okay, when you're young. And so I don't usually bring in DHEA 25 milligrams per pill for men only. I don't use that for women because it'll give them pimples, it'll give them enlarged pores, it'll give them blackheads. I bring it in for men about age 45 or so. And really, if you get blood work, you should have a DHEAS blood level, okay? And see what your DHEA is. But remember, DHEA, I mean, it varies from minute to minute. So you have to look at symptoms, and those symptoms are on the website, on the symptom pages. And so the pills I don't use for men until they're older. And then if men have enlarged prostates or prostate cancer, you have to be really careful about using DHEA. Again, virtual consultation or see your doctor. Very important that. Now, estriol as the Brits say, estriol, is a weaker estrogen of young women. The Brits discovered back in the 60s that young women who get breast cancer usually have low estriol. And was that due to low thyroid? Maybe, okay? And so estriol I usually don't bring in until women get well into their 40s. They're sort of getting perimenopausal. You know, their skin's starting to get thinner. And then I'll use one pump every other day on the surface of the skin, eyelids, face, neck, hands, plumps up the skin. Also, if you have dry vagina, it is the cure for dry vagina. But if you're young, you shouldn't have a dry vagina. Something's wrong with your hormones. And that's when you start looking for the adrenal, thyroid, omegas, you know, making sure that you're healthy internally, you're not all inflamed, etc. And so estriol support is what it's called. You put on the surface of your skin. Once you get to be 45, 46, 47, 48 generally, and too much, and your breast will get a little bit tender. It plumps up your nipples a little bit. I have women who breastfed a lot, and their breasts get all deflated. And I'll put some, that means their estriol is low, and I'll often put a little estriol on their breast to help plump them up a little bit, perks up your nipples a little bit, really good for dry vagina, because you can also take a pump and put it in your vagina with your finger. For people who have dry labias, dry vaginas, I usually do that with women who are menopausal, okay? Nobody usually has dry vagina until then, unless things are really bad with their adrenals and their thyroid. And then I fix those first. So estriol support is, okay, the other thing that a lot of people have is metabolic syndrome. Women who really struggle with their weight, voluptuous, they have bigger breasts, they really struggle mid-abdominally. Those women, and you need to Google metabolic syndrome, those are people who normally have genetically higher estrogen, okay? And that's estrogen equals estradiol, estradiol, estradiol. Estradiol, those are the women who have metabolic syndrome, who have to exercise more, and forgive me because I always feel bad when I say this, but they have to exercise more, they have to avoid carbs like the plague, they're poison. They tend to have higher cholesterol genetically. It's because they're metabolic syndrome. Genetically, they often have higher blood sugar. Anything you eat that's carb goes to sugar, sugar goes to cholesterol or triglycerides and to fat. And so that's why metabolic syndrome people struggle with their weight. They're a keto diet person, okay? They do better. And again, eat right for your blood type. So, and if you're A and you don't digest, you don't have enough hydrochloric acid, and you don't digest your protein well, you got to optimize the HCl. But metabolic syndrome, those women are the last people you want to give any estradiol to. Now, once they get menopausal, because you usually produce estradiol a good couple of years after you're menopausal, they're the last people that I give estradiol. But if they